was diagnosed with an acetylglutamate synthetase deficiency.
My son Tucker is 15, spent the first 4 months of his life in the NICU. He has a brain injury.
I went home to basically mourn the loss of the perfectly healthy child that I thought I was going to have.
My name is Chris Holliday. Our daughter is our last child of 6 children. She has hydrocephalus with resulting cerebral palsy and mental delays.
Had a biological child. He was a 25-weeker, and we've adopted our other children, and all special needs.
Families aren't prepared to have a child arrive in their home that has medical conditions or illnesses that they are not familiar with.
The stress level on the children going to doctor after doctor after doctor, office after office after office, is extremely high.
It'd be really difficult if we had to traipse around town and Annie had to go to different offices.
These families amaze me. They might have a child with special health care needs for 20 years or 30 years. You have to have scales that know how to weigh children in wheelchairs. You have to have space large enough and rooms large enough for them to be able to get into. You need to have phlebotomists that know how to draw blood on a child who might otherwise be very difficult to draw blood from. You need to have therapists that are familiar with a physical exam that's not the same, perhaps, as a well child's physical exam. It's really helpful to be able to put children in a delivery system, and in this case, literally in one building, that brings all of the talent, the breadth and depth of specialists into one place.
Children are treated individually by everybody, but they're followed by us as a team. So the CRS program allows the children to come in, be seen by the plastic surgeon, be seen by the speech pathologist, and be seen by me, all in the same visit.
To have all the doctors in the same place, talking about the same patient at the same time, is invaluable for the family.
This was a place where we could come and get comprehensive care in one place. We were getting neurology care, orthopedics, orthotics, pharmacy, all in one place, and they were talking with each other.
The doctors here at CRS can have access to my children's records immediately.
Because it brings providers to one place. They have an opportunity to talk about their patients, because that's how interdisciplinary care happens. This is an example of something you wouldn't find in private practice in a typical physician's office. You wouldn't have access to a gym like this. So a gym like this allows us to see the patient in their daily routine. We get to see what they look like in their wheelchair, we get to see what they look like in their walker, do a full physical exam, and then have all of the disciplines chime in on how to help that child best get through his or her day.
Medicare says a stage 4 decubitus ulcer costs $90,000 to fix. We try to catch them when they're stage 1, and hopefully we've saved that expense.
Having CRS being comprehensive, that meets multiple needs, whether it be from eye clinic, hearing, orthopedic clinics,
Physical therapists, occupational therapists, speech therapists, wheelchair clinic.
It's taught me a lot. It's taught me how to advocate for myself and how to stand up for what I need, how to be as independent as I can be.
At least here you feel like you're in a community where the other families get it.
Once we came for the first time, that's when my eyes just opened up and I thought, this is a huge resource for us and it's going to make our lives tremendously different.
This is a program that should be modeled by the other states.
States that don't have programs for these children, they don't get care.
CRS has kept my children alive.
I don't know what they'd do without it if they didn't have this program to go to.
what would we be without CRS? We would be at a loss.
I mean, this is something to be aspired to.
CRS has been, without a doubt, a lifeline.